Hi, my name is Claire Burkhardt, and this PowerPoint presentation is going to include my personal nursing philosophy, an illustrative story, and some general thoughts on nursing ethics in general. I deeply and truly believe that getting to call myself a nurse is an unbelievable honor. What it means to be a nurse extends so far beyond the specialized set of clinical skills we acquire, the uniforms we wear, but really speaks to our character, our values, and the standards to which we hold ourselves in our professional and personal lives. Nurses have consistently been ranked as the most trusted profession by the American public based on honesty and ethical standards, which really comes as no surprise since values such as kindness, sympathy, responsibility, commitment, justice, and competency are so strongly ingrained in every aspect of our nursing culture. While many aspects of nursing's core values are professionally shared, they're also deeply personal and drawn from one's personal background, experience, and guiding philosophies. When evaluating how my personal background and experience helped to shape my personal nursing philosophy, I think it really boiled down to three key concepts. In all aspects of my life, I strive to demonstrate excellence, openness, and compassion, and these are values that I carry into my practice as well. To me, excellence in nursing entails utilizing best practice, managing my time wisely, dedicating myself to my patients and my profession, and providing the best possible care to each person I encounter. Openness in my personal and professional life allow me to continually learn and experience new things. By remaining open and understanding, I'm able to be receptive to the unique physical, emotional, social, and spiritual needs of my patients and provide holistic, patient-centered care. Finally, compassion is something a good nurse cannot be without. I have a deep and genuine concern for the well-being of everyone I meet, and when caring for others, this is truly key. A therapeutic nurse-patient relationship is built on tenderness, patience, care, non-judgment, and empathy. I've found putting these ideals into my practice not only improves my patients' health outcomes, but also makes the difficult job of nursing easier and certainly more fulfilling. So what does this personal nursing philosophy actually look like in practice? I currently work in an ambulatory surgery center, and a few weeks ago had the opportunity to meet a patient whom I'll call John. John was not the most pleasant patient I've prepared for surgery. He was ornery, condescending, verbally abusive, and generally just in a sour mood. While it's difficult not to take challenging scenarios such as these personally, I tried to remain calm, understanding, and empathetic to the concerns and complaints that John was sharing. After a while, he began to calm and confided in me that he was concerned about how his surgery would affect his ability to care for his wife, who is in the final stages of lung cancer. He was frustrated by the post-operative restrictions that would further burden his ailing wife, causing him to feel worthless and vulnerable. Despite John's less than pleasant initial demeanor, remaining open and compassionate allowed me to respect the inherent self-worth and importance of John's concerns without judgment and promoted trust within the nurse-patient relationship enough for John to open up and tell me about what was truly bothering him. This also underlines the impact of environment. What was going on in John's personal life was directly impacting his response to the care that I was attempting to provide. By responding to his concerns over the post-operative restrictions, we were able to brainstorm and troubleshoot together to find solutions and modifications that would empower John and lessen the burden on his ailing wife. John also demonstrated how health is not merely comprised of one's physical condition, but encompasses their psychological and social well-being. At that point in time, his physical body was not his primary barrier to health. It was rather the stress and difficulty in coping with the possibility of losing his life partner. Through therapeutic communication and empathetic listening, I was able to display excellence in my nursing practice to address how these factors influence John's health and guide my plan of care for his stay. In conclusion, as nurses, we are invited into patients' lives in times of great uncertainty, sadness, fear, joy, or relief. The unique position we hold in such intimate moments provides an amazing opportunity to make a real difference in our patients' lives, but also entails a great responsibility. By staying true to the values and ethical standards put forth for us as nurses, and by identifying the personal values which guide our practice, we may best serve, advocate for, and help heal all those in our care.